With kids back to school and at the onset of monsoons, colds and coughs become a common scenario in most of our kids. So this is the season where we see common cold, as it's rightly termed. What is this common cold? Common cold is a viral infection caused by more than 200 types of viruses. Rhinoviruses are considered the most common. It's a contagious disease. It spreads from one person to another, usually with sneezing, coughing. We call it a droplet infection, where the small droplets, they settle on the surfaces. When someone comes in contact with that and he touches his nose and mouth, it can cause infection. These viruses enter through the mucosa in the nose and to the throat, and they cause a set of immune reaction in the body which makes the child to have the symptoms of cold and cough. So what are the common symptoms of this disease? Child usually has a runny nose, a stuffy nose, sneezing, develops cough, develops fever, body ache, headache. Child has generalized distress with loss of appetite. So this makes, with child not eating well, puts the whole family into distress. So how long does this disease last? Usually it is 2 to 3 days from the time a child comes in contact with a person with cold. The symptoms start. Symptoms worsen usually by day 5. It usually lasts for a week. Sometimes it can go up to 10 days. Usually, child will be very infective to the other children between 2nd to 4th day. How can we treat this condition? Common cold doesn't have any specific treatment. Time cures all. This very well applies to treatment of common cold. But we do give medications to ease the distressing symptoms of common cold. So we would recommend home remedies, especially hot water with honey. You can give some steam inhalations, plain steam inhalations. You can use nasal saline drops to clear the stuffy nose. You can use paracetamol to alleviate symptoms like fever and body ache in children. Coming to the diet part, of course, we don't have any restriction in diet, but giving warm food, hot food usually suits the child. Warm soups, even warm milk with little turmeric, these are some home remedies, do help in alleviating the symptoms of common cold. Then coming to the prevention, how can we prevent common cold? Yes, simple hygiene matters. So cleaning hands before touching the nose and mouth, or making a child with cold to sneeze into a tissue, or making the child sneeze into his elbow rather than to his hands will help in preventing the spread of infection. Also staying away from a person with cold. And when it comes to infants, babies who are fed by the mother, if mother contracts a cold, she has to just cover her nose and mouth when in close contact with the baby. She can use a hand sanitizer every time before she touches the baby. Now coming to the danger signs or when to meet your doctor. All common colds are not serious. Of course, when child has a fever of more than 103 degree Fahrenheit or persistently for more than a day, or you feel child has an earache, child has any discharge from the ear, or when you feel the child is vomiting out a lot of phlegm which is thick, and you feel child is having persistent vomiting and making the child having dehydration, then those are the times when you need to meet your doctor. There are some myths about common cold. People think not wearing a sweater in the cold season or not just stuffing cotton into their ears will make them get cold, or having a cold wet hair will make them get cold. But however, these don't have any scientific basis. Common colds are because of viruses. Then coming to using, they say chicken soup is going to cure of common cold. No, of course, there are some things diet contains which makes the mucus thin and go out of the body, but there's again not much of a scientific data for this. Will drinking milk worsen my cold? Usually not. Milk can make it your mucus thick, but it will usually not worsen the scenario of common cold. So common cold is nothing to be scared of, but it needs attention, and as I said, if it worsens, then you need to meet your doctor. Thank you.